Sulpiride, Wikipedia audio. Sulpiride, dalmetyl, eglanil, espiride, modal, promoter, sulpir and others is an atypical antipsychotic drug of the benzamide class used mainly in the treatment of psychosis associated with schizophrenia and major depressive disorder, and sometimes used in low dosage to treat anxiety and mild depression. Sulpiride is commonly used in Asia, Central America, Europe, South Africa, and South America. Levosulpiride is its purified levo isomer and is sold in India for similar purpose. So far it has not been approved in the United States, Canada, and Australia. The drug is chemically and clinically similar to amisulpride. Sulpiride's primary use in medicine is in the management of the symptoms of schizophrenia. It has been used as both a monotherapy and adjunctive therapy in schizophrenia. It has also been used in the treatment of dysthymia. Augmentation with sulpiride has also been tried as a strategy for accelerating antidepressant response in patients with major depressive disorder. There is also evidence of its efficacy in treating panic disorder. Sulpiride is usually well tolerated, producing few adverse effects. Their incidences are as follows. Medical uses. Contraindications. Cautions. Hypersensitivity to sulpiride, pre-existing breast cancer or other prolactin-dependent tumors, pheochromocytoma, intoxication with other centrally active drugs, concomitant use of levodopa, acute porphyria, comatose state or CNS depression, bone marrow suppression. Sulpiride has a relatively low order of acute toxicity. Substantial amounts may cause severe but reversible dystonic crises with torticollis, protrusion of the tongue, and slash or trismus. In some cases all the classical symptoms typical of severe Parkinson's disease may be noted, in others, oversedation/coma may occur. The treatment is largely symptomatic. Some overall extrapyramidal reactions may respond to the application of anticholinergic drugs such as piperidine or benzatropine. All patients should be closely monitored for signs of long QT syndrome and severe arrhythmias. Sulpiride can be synthesized from 5-aminosulfosalicylic acid. Methylating this with dimethyl sulfate gives 2-methoxy-5-aminosulfonylbenzoic acid, which is transformed into an amide using 2-aminomethyl-1-ethylpyrrolidine as the amine component and carbonyl-diimidazole as a condensing agent. Sulpiride is a selective antagonist at dopamine D2 and D3 receptors. This action dominates in doses exceeding 600 mg daily. In doses of 600 to 1,600 mg sulpiride shows mild sedating and antipsychotic activity. Its antipsychotic potency compared to chlorpromazine is only 0.2. In low doses its prominent feature is antagonism of presynaptic inhibitory dopamine receptors, accounting for some antidepressant activity and a stimulating effect. Therefore, it is in these doses used as a second-line antidepressant. Additionally, it alleviates vertigo. The benzamide neuroleptics have been shown to activate the endogenous gamma-hydroxybutyrate receptor in vivo at therapeutic concentrations. Sulpiride was found in one study in rats to upregulate GHB receptors. GHB has neuroleptic properties and it is believed binding to this receptor may contribute to the effects of these neuroleptics. Sulpiride, along with clozapine, has been found to activate DNA demethylation in the brain. Pre-existing Parkinson's disease, patients below 18 years of age, pre-existing severe heart disease/bradycardia, or hypokalemia, patients with pre-existing epilepsy. Anticonvulsant therapy should be maintained. Lithium use increased risk of neurological side effects of both drugs. Sulpiride was discovered as a result of a research program by Justin Besançon and C. Laville at Laboratoires Delagrange, who were working to improve the antidysrhythmic properties of procainamide. The program led first to metoclopramide and later to sulpiride. Laboratoires Delagrange was acquired by Saint Hilabo in 1991, which eventually became part of Sanofi. Pregnancy and lactation. Adverse effects. Contraindications and cautions. Overdose. Synthesis. Pharmacology. History.